Hello, everyone. My name is Shannon, and I'm here from AY Benefits to go over your benefits renewal for June 1st, 2020. First, I will go into the health plans, which are provided through CareFirst, and then I'll go over the ancillary benefits, which are through MetLife. Open enrollment will be conducted from Monday, May 11th to Monday, May 18th. All changes will be effective for June 1st, 2020. This is your opportunity to join the plan if you're not a current participant, add or drop dependents, or make changes in coverage. Outside of open enrollment, you are only permitted to make changes if you have a qualifying life event. Examples of this would be a change in number of dependents, change in marital status, or change in employment status. If you don't already have an account with CareFirst, now would be a good time to register. It's very easy. You would just go to www.carefirst.com and click on the member tab and click on register. Once you have an account, you can verify your eligibility, view benefits, view claim status, review and print EOBs or explanation of benefits, track out-of-pocket expenses, and compare drug prices. Before we get into the health plan, I just want to go over Teladoc. If you don't already know what Teladoc is, it's a service where you can talk or video chat with a board-certified physician 24/7 who can diagnose and prescribe. This would be available to all employees and any family members. This is a voluntary benefit, so the cost would be $8 a month or $3.69 per pay. One thing I did want to add, because I know there's been questions around it, CareFirst does offer video visits, normally at a cost through your deductible, co-insurance, or co-payment. But at this time, due to the COVID-19 pandemic, CareFirst is waiving all member costs to promote social distancing. Now, this waiving of costs is not permanent, but I did want to add that in there so you can take it in consideration whether or not to purchase Teladoc. Also would like to go over some definitions of words you might see throughout the presentation. Deductible would be the amount that you must pay before insurance reimburses for some services. Copay would be a fixed dollar amount, for example, $30 when you go see your doctor. Coinsurance is your share of the cost for a service, for example, 10%. So if your bill is $100, you pay $10. Your out-of-pocket max is the most you could pay during a coverage period, which would be June through May. Now getting into the health plans, there are three plans currently offered, and there are no changes from last year. The first plan is the CareFirst Blue Choice Advantage PPO number 4. There's no deductible. The coinsurance is 100%. The out-of-pocket max is $1,500 for an individual and $3,000 for a family. Office visit would be $20 copay for a primary care physician and $20 copay for a specialist. Urgent care would be a $20 copay. Emergency room would be $100 copay, and inpatient hospital would be a $250 copay. Out of network, the deductible is $500 for an individual and $1,000 for a family. Coinsurance is 70%. Out-of-pocket max is $3,000 for an individual and $6,000 for a family. Office visit is 30% coinsurance. Inpatient hospital is 30% coinsurance. The next plan is the CareFirst Blue Choice HMO Open Access Option 13. There is no deductible. The coinsurance is 100%. The out-of-pocket max is $1,300 for an individual and $2,600 for a family. Office visit is $30 copay for a primary care physician and a $40 copay for a specialist. Urgent care would be a $40 copay. Emergency room is a $50 copay. And inpatient hospital is a $300 copay. Now, since this is an HMO plan, you must stay in network unless it's an emergency. The last plan is the CareFirst Blue Choice HMO Open Access Option K. There is a $1,000 individual deductible and $2,000 family. Coinsurance is 80%. Out-of-pocket max is $2,500 for an individual and $5,000 for a family. Office visit would be deductible and then $20 copay for a primary care physician and $30 copay for a specialist. Urgent care would be deductible and then $30 copay. Emergency room would be deductible and then $100 copay. Inpatient hospital would be deductible then 20% coinsurance. The pharmacy coverage is actually the same on all three plans. Generic will be a $15 copay. Preferred brand will be a $35 copay. Non-preferred brand will be a $60 copay. And specialty would be 50% up to a max of $150. Now, how are premiums paid? Now, there's a lot of information on here, but what we want you to focus on is the numbers in red. So on the far right column here, we have the current employee per pay period cost. And this fifth column, we have the employee per pay period cost adjusted by the rebate. And this would vary depending on what plan you're in and what coverage level you have. Preventative care is fully covered under all medical plans. Examples of services that would be covered are annual primary care checkup and screenings such as A1C, blood pressure, cholesterol, type 2 diabetes, and immunizations such as flu shot and tetanus. There are also additional covered services for women: breast cancer screenings for women over 40, cervical cancer screenings, mammogram screenings, pap smear screenings, and contraception. Additional ways to save: you should always try to use the emergency room for true emergencies. If you do have any minor injuries or illnesses, consider retail convenience care clinics or urgent care centers. If you have lab work that you need to get done, it's always best to go to a national lab such as Quest Diagnostics or LabCorp, as you can save up to 75% off. If you have any maintenance medications, you should try to convert those to mail order. You'd be able to get up to 90-day supply so you don't miss a dose. You could refill orders online, get free shipping, or order by phone. And as always, you should try to choose in-network providers. If you go out of network, you have the possibility of being balance billed, which means the provider would bill you the difference between what they charge and what the insurance company pays. Now I'll go over the dental, which is through MetLife. There is a $50 individual deductible and $150 for a family. The annual max is $1,500 for an individual. The lifetime ortho max is 50% up to a max of $1,500 for an individual. Preventative and diagnostic services such as exams, x-rays, cleanings, and fluoride treatments are covered at 100%. The deductible does not apply. Basic services such as fillings are covered 80%. The deductible does apply. For major services such as crowns and dentures would be covered at 50%, and the deductible does apply. For child-only ortho for children up to age 19, the services are covered at 50%. Vision is also through MetLife. Eye exams are covered every 12 months and there's no copay. Lenses are covered every 12 months. There is no copay and they are covered in full. Frames would also be covered every 12 months. There is no copay and they are covered in full up to a max of $130. So anything in excess of that is your responsibility. Contact lenses would also be covered every 12 months. Elective contact lenses would be covered in full up to $130. Anything in excess of that would be your responsibility. Medically necessary contacts would be covered in full after a $60 copay. Now, I did want to add, the frames and contact lenses, you have to get one or the other in a given year. You cannot have both. Now, how are premiums paid for dental and vision? The fourth column here is the employee per pay period cost. And the third column would be your employee monthly cost, again, focusing on the numbers in red. Additional company paid benefits would be short-term disability, long-term disability, and term life insurance and AD&D. For short-term disability, your elimination period is 14 days. Your maximum duration is 11 weeks. Your benefit percent is 60% up to a max of $1,000 a week. For long-term disability, your elimination period is 90 days. Your maximum duration is SSNRA, or Social Security Normal Retirement Age. Your benefit percent is 60% up to a max of $7,000 a month. Your term life insurance and AD&D are both $50,000. And there also is an age reduction. At age 65, there is a 35% reduction. And at age 70, there is a 50% reduction. These benefits are paid 100% by CDA. So next steps is review your health insurance options with your family. Visit aayaccess.com to make your elections by Monday, May 18th if you're going to make plan changes. If you're going to keep the plans that you're in currently, then you do not need to go into AY Access. Remember that outside of open enrollment, you must have a qualifying life event to make changes, so please choose your benefits and coverage levels appropriately. Please notify HR within 30 days of a qualifying life event. If you have any questions, feel free to reach out to Corey or myself. My email is squinn@ayallc.com. Thank you and have a great day.